Hello, welcome to learning the ABCs of Medicare. Turning 65 and having to enroll in Medicare can seem like a never-ending maze. I'm sure just like this couple, you have received tons of mail, letters, solicitations from different insurance companies and agents asking you to call them and reach out to them about Medicare. My name is Michael Matullo. I'm a licensed insurance producer, and I'm very excited to go through a brief summary of Medicare with you today. Let's talk about our agenda. First, we're going to talk about the history of Medicare in America, when to enroll in Medicare, the different parts A, B, D. We're going to discuss supplement plans versus advantage plans. We're going to highlight what is not covered. And then lastly, we're going to discuss your decision and next steps. Medicare is a social insurance program administered by the United States government, providing health insurance coverage to people who are age 65 and over or who meet other special criteria. Medicare is the nation's largest health insurance program, currently covering approximately 65 million Americans. Social Security Administration is responsible for enrolling people into Medicare. When to enroll? You are first eligible to sign up for Medicare 3 months before your 65th birthday. Coverage always begins first of the month. For example, if your 65th birthday is July 19th, your Medicare coverage begins July 1st. You may be eligible to enroll in Medicare earlier if you have a disability, end-stage renal disease, or ALS. At the bottom of the screen is the red, white, and blue Medicare card. This lists the date your Part A and Part B coverage was effective and also your ID number. Working beyond age 65. If you work at a company with fewer than 20 full-time employees, Medicare is primary the first of your birthday month when you turn 65. That means you must sign up for Medicare immediately. If you work at an employer with 20 or more full-time employees, Medicare is secondary, so you can remain on that group health insurance plan if you wish. You also may enroll in Medicare Part A. Medicare Part A has 0 premium if you've worked at least 40 quarters. Some choose to do this. However, if you enroll in Medicare Part A, you can no longer contribute to health savings accounts. Let's dive a little bit deeper into Medicare Part A. This is the hospital insurance. Medicare Part A covers hospital stays, home health care, hospice care services, and also inpatient care in a skilled nursing facility. For these covered services, a deductible, co-payment, or co-insurance may apply, and there is no maximum out-of-pocket limit. Medicare Part A does not cover long-term care. For an in-hospital stay, there are different charges per benefit period. This is listed on the screen. For example, days 1 through 60 of an in-hospital stay, the member is responsible for the Part A deductible. Beyond day 60, days 61 through 90, the member is responsible for a per-day copayment. If they stay longer than 90 days, days 91 through 150, the member is responsible for a per lifetime reserve day copayment. If you're still in the hospital beyond 150 days, the member is responsible for all costs. A stay in a skilled nursing facility has similar charges listed on the screen. Days 0 through 20, the member is responsible for nothing. It's a $0 copayment. Days 21 through 100, a member is responsible for a per day copayment. A stay in a skilled nursing facility beyond 100 days, the member is responsible for all costs. Now we're going to review Medicare Part B. This is the medical insurance, also known as outpatient services such as doctor visits and physical or occupational therapy. Part B covers your physician visits, clinical labs, outpatient hospital services, preventative care, and durable medical equipment. Part B has an annual deductible for all services. After the deductible has been met, Medicare typically pays 80% of approved charges. There is no maximum out-of-pocket limit. IRMA may also apply to your Medicare Part B premiums. What is IRMA? IRMA is the income-related monthly adjustment amount. Medicare uses your modified adjusted gross income on your tax return from 2 years prior to determine IRMA eligibility. The higher the range of your modified adjusted gross income, the higher the IRMA. IRMA applies to Part B and Part D. On the screen here is the chart explaining those who must pay the additional IRMA and those whom IRMA does not apply. So they take a look at your modified adjusted gross income from 2 years ago on your tax return, and that's what determines whether or not IRMA will be assigned to your account. Next, we're going to review Medicare Part D. This is your prescription drug coverage. You must be enrolled in Original Medicare Parts A and B to join a prescription drug plan. Part D helps cover the cost of prescription drugs, including many recommended shots and vaccines. All plans must cover a wide range of drugs, including protected classes such as cancer medications and HIV medications. All Medicare Part D prescription drug plans can be found on Medicare.gov and are run by private insurance companies that follow rules set by Medicare. IRMA may apply to your Medicare Part D premium. It's also important to note that lifetime penalties and lockout periods apply for those who enroll late in Medicare Part D. On the screen, I have listed, just like Part B, the Part D IRMA for those who have a higher modified adjusted gross income and those whom which IRMA will not apply. So depending on where, if you are filing individually or a joint tax return, depending on where your modified adjusted gross income was 2 years prior, that determines whether or not IRMA will be assigned to you. Medicare Part D also has an annual open enrollment period beginning October 15th, ending December 7th. This is your annual opportunity to join, drop, or switch to a different prescription drug plan. These changes are effective January 1st of the next year. As I stated, all prescription drug plans, Part D, can be found on Medicare.gov. Next, we're going to discuss Medicare supplement plans and Medicare Advantage plans. Original Medicare is parts A and B. In addition to that, we suggest you purchase a Medicare supplement plan, Plan G, and also a Medicare Part D prescription drug plan. Medicare Advantage plans combine parts A and B, and then many include prescription drug coverage as well. Medicare supplement plans may have higher premiums, but typically have lower or no copayments. There are no networks associated with Medicare supplement plans. You have the freedom to choose any doctor that accepts Medicare. There are no referrals necessary within supplement plans, and you can be covered anywhere inside of the United States, so as long that the provider accepts Medicare. If the provider accepts Medicare, the supplement plan will pay. Some routine services, however, are not covered, such as dental or vision, within supplement plans. Medicare Advantage plans generally have lower monthly premiums, but come with deductibles, co-payments, and coinsurance. Many Advantage plans bundle a prescription drug coverage. However, members are often restricted to the network of providers that accept that Advantage plan. And you may need referrals from your primary care physician to visit a specialist. These plans sometimes include dental and vision coverage. However, the only thing that's covered outside of the plan's service area are emergency services. There are private networks within Advantage plans. There are not within supplement plans. Most Advantage plans also require referrals. Supplement plans do not. We suggest our clients take a very close look at Plan G, the Medicare Supplement Plan G. The reason is the plan covers everything except for the Medicare Part B deductible. The member is responsible for the Medicare Part B deductible, the monthly premiums, and then after that, the supplement plan will pay what the Medicare does not. We're going to review a quote on the next slide. As you can see from left to right, these are covered services under Medicare Part A. The middle column shows what Medicare will pay. The next column shows what this supplement plan will pay. The last column, all the way on the right, highlighted in yellow, is what you are required to pay. Members are required to pay 100% for hospitalization beyond 365 days and all costs in a skilled nursing facility care days 101 and beyond. Medicare Part B, once again, from left to right, is the covered services, what Medicare pays, what this supplement plan G pays, and then lastly, what you are responsible to pay. For Part B services, you are responsible to pay the Part B deductible, and then the plan pays the rest. Which insurance carrier is the best for my supplemental coverage? Well, there are no networks from the different supplement carriers. So the things that we consider is the monthly premium, also the years in the market, and any discounts that may be offered through these carriers. Some carriers offer a household discount, reducing the premium if both spouses have the same supplement carrier. Many carriers also include an EFT discount. If you agree to pay with recurring automatic draft, they'll reduce the monthly premium. Here is what the average cost looks like for a 65-year-old male in New Jersey who does not have to pay IRMA. Part A, there's a 0 monthly premium because this individual has worked at least 40 quarters. The Part B base premium in 2025 is approximately $185. The Plan G supplement premium is approximately $180 monthly. The Part D prescription drug plan average monthly cost is just shy of $37 a month. This brings the monthly total to just north of $400. What is not covered by Medicare? Medicare does not cover any of the following: long-term care services, routine dental or eye care, cosmetic surgery, hearing aids. These are all services that would require an additional policy. It's not covered by Medicare. If you have any questions or you'd like some further information, please reach out to us directly by phone or by email or by visiting our website, www.groupbenefits.com. Thank you very much. Have a great day, and we look forward to speaking with you soon.